When most people think about eye discomfort, they often chalk it up to fatigue, allergies, or simply spending too much time staring at screens. However, in many cases, the underlying culprit is far more subtle and surprisingly common. Dry eyes. Dry eye syndrome. DES is a condition that occurs when the eyes don't produce enough tears or when the tears evaporate too quickly, leaving the eyes irritated, red, or watery in a paradoxical response. While it might seem like a minor nuisance, dry eyes can actually be the reason behind a wide range of ocular and even systemic conditions. Understanding dry eyes requires understanding the complex role that tears play in eye health. Tears are not just water. They are a delicate mixture of water, oils, and mucus that lubricates the eye, protects against infection, and ensures clear vision. When this tear film is compromised, it can lead to inflammation, corneal damage, and even changes in vision over time. Research shows that dry eyes affect millions worldwide, and the prevalence increases with age, making it one of the most common reasons people seek eye care. Symptoms that point to dry eyes. Dry eye symptoms can be surprisingly variable, which often makes diagnosis tricky. Common signs include a stinging or burning sensation. This is often described as feeling like sand in the eyes. Redness and irritation. Inflamed eyes are a typical response to inadequate lubrication. Blurred vision. Tears are essential for clear vision. Without them, focus becomes unstable. Excessive tearing. Ironically, when the eyes are dry, they may overcompensate by producing watery tears. Sensitivity to light. Dry eyes can make you more prone to glare and photophobia. Difficulty wearing contact lenses. Insufficient tear production can make lenses uncomfortable or intolerable. Many people experience dry eyes intermittently, thinking it is temporary. However, when these symptoms become chronic, they may indicate an underlying dry eye condition that requires attention. Causes of dry eyes. The causes of dry eyes are multifactorial, often involving environmental, lifestyle, and physiological factors. Some of the most common contributors include aging. Tear production naturally decreases with age, particularly in women after menopause due to hormonal changes. Screen use. Prolonged staring at digital devices reduces blinking, which in turn reduces tear distribution. Medications. Certain drugs, including antihistamines, antidepressants, and blood pressure medications, can decrease tear production. Medical conditions. Autoimmune disorders such as Sjogren's syndrome, rheumatoid arthritis, and lupus can interfere with tear production. Environmental factors. Exposure to wind, dry air, smoke, or air conditioning can accelerate tear evaporation. Contact lens use. Wearing lenses for extended periods can exacerbate dryness. Recognizing these risk factors is the first step in addressing dry eyes before they lead to more serious complications. Dry eyes and related conditions. Dry eyes don't just cause discomfort, they can also be a root cause or contributing factor for several other conditions. 1. Chronic eye infections. Tears contain enzymes and antibodies that protect the eye from bacteria and viruses. When tear production is insufficient, the eyes are more vulnerable to infections such as conjunctivitis. Chronic dryness can also make it harder for the eyes to fight off existing infections, prolonging recovery time. 2. Corneal damage. The cornea is the clear, protective outer layer of the eye, and it relies on a stable tear film for health. Prolonged dryness can cause scratches, erosions, or ulcers on the cornea, which can result in pain, blurred vision, or even permanent scarring if untreated. 3. Eye fatigue and headaches. Dry eyes can lead to excessive eye strain, especially when reading, working on a computer, or performing tasks that require visual focus. This strain can trigger headaches, difficulty concentrating, and a feeling of constant fatigue. 4. Worsening of pre-existing eye conditions. Individuals with glaucoma, diabetic retinopathy, or cataracts may find that dry eyes exacerbate their symptoms. Poor tear quality can interfere with the effectiveness of eye drops used for these conditions, reducing their therapeutic benefits. 5. Vision fluctuations. Without a smooth tear film, the eye's surface becomes irregular, leading to intermittent blurry vision. This is particularly noticeable when switching focus from near to far objects, driving at night, or reading for long periods. Diagnosing dry eyes. If you suspect that dry eyes may be behind persistent eye discomfort or other conditions, a comprehensive eye exam is essential. Eye care professionals may use several tests to assess tear production and quality, including Schirmer test, measures tear quantity using a small strip of paper placed under the lower eyelid. Tear breakup time, TBUT, evaluates how long tears remain on the eye before evaporating. Ocular surface staining, uses dyes to identify damage to the cornea or conjunctiva. Meibomian gland evaluation, checks for blockages in the glands responsible for producing the oil layer of tears. Proper diagnosis is crucial because dry eyes can mimic or coexist with other ocular conditions, and treatment needs to be tailored to the underlying cause. Treatment options. Fortunately, dry eyes are highly manageable with the right combination of lifestyle adjustments, over-the-counter solutions, and medical interventions. 1. Artificial tears and lubricating drops. These are often the first line of treatment. Different formulations address various aspects of tear deficiency. Some focus on hydration, others on restoring the lipid layer to prevent evaporation. 2. Prescription medications. For chronic or severe cases, medications such as cyclosporin or lifitegrast can help reduce inflammation and improve natural tear production. 3. Lifestyle adjustments. Simple changes can have a significant impact. Take regular breaks from screens and follow the 20-20-20 rule. Look 20 feet away. Every 20 minutes for 20 seconds. Use a humidifier in dry indoor environments. Wear sunglasses outdoors to protect eyes from wind and UV exposure. Stay hydrated by drinking plenty of water. 4. Nutritional support. Omega-3 fatty acids found in fish oil or flaxseed supplements have been shown to improve tear quality and reduce inflammation. 5. Procedures and devices. For persistent cases, procedures such as punctal plugs can help retain tears on the eye surface. Advanced treatments like intense pulse light, IPL therapy, target meibomian gland dysfunction to restore natural oil flow. Preventing dry eyes. While treatment is essential, prevention is equally important, especially for people at higher risk. Key preventive strategies include maintaining proper eyelid hygiene to prevent gland blockages, avoiding prolonged exposure to air conditioning, heaters, or direct fans, limiting extended screen time, or ensuring proper screen ergonomics, using protective eyewear during outdoor activities, regularly scheduling eye exams to catch early signs of dryness. By proactively addressing dry eyes, you can prevent a cascade of related problems, from infection and inflammation to vision disturbances and headaches, when dry eyes could be the reason. Many people dismiss dry eyes as a minor annoyance, but evidence shows that untreated dry eye syndrome can be the underlying reason for a range of ocular and even systemic issues. From blurred vision and chronic eye irritation to corneal damage and headaches, dry eyes often act as a hidden trigger for problems that seem unrelated at first glance. In some cases, persistent dryness may also signal underlying autoimmune conditions, hormonal imbalances, or medication side effects. Understanding that dry eyes may be the reason behind these discomforts can be a crucial step toward better eye health. Addressing the root cause, not just the symptoms, can prevent complications, improve vision clarity, and enhance overall quality of life. Take action today. If you frequently experience itchy, burning, or watery eyes, it's time to consider that dry eyes might be at the root of your discomfort. Don't wait until the condition worsens. Early intervention can prevent long-term damage and help you maintain clear, comfortable vision. Schedule a comprehensive eye exam, explore appropriate treatment options, and make simple lifestyle changes to support tear production and eye health. Your eyes are your window to the world. Give them the care they deserve. Act now and take the first step toward relief from dry eyes today.